When you're thinking about eligibility criteria for your outcome measures, obviously you want to provide a conceptual and operational definition for what an eligible outcome is. Sometimes people use logic models in assisting with defining outcomes. This isn't necessary for all Campbell reviews, but it can be useful, especially at the planning stage if you're doing a program evaluation type of review. So this is a logic model for, I think, after-school programs. And so essentially what they've said here is, okay, we think that these after-school programs should lead to immediate changes in supervision of students, students' academic support, which then lead to these kind of behavioral changes in homework completion, television viewing, which then should have an effect on longer-term outcomes like grades. And so having logic models like this can help you identify those more intermediate versus distal outcomes that may be relevant for you to measure and include in your systematic review. So you don't have to do this, but I think they can be useful, especially for complex interventions where you have quite a bit of moving parts. Trudy, yeah.
Sorry. So I'm a big fan of logic models, but my area is assessment tools. Is there an example that you can provide? Do you know of a logic model for a systematic review around assessments that could help? Just to see as a template?
I don't know of one offhand.
I sort of like the idea for
but I can look into it. I will look into that for you.
Thank you.
But I don't know of one offhand, but I bet there is one. Mm-hmm. Now, other things to think about with your outcomes, I really am not allowed to get anywhere near that speaker. I'm sorry. Okay, so other things to think about with your outcomes is, obviously you want to have good definitions. So, for instance, if you're going to be looking at academic achievement outcomes, it's nice to have both a conceptual definition of that, so a person's level of knowledge in a specific academic domain, but also to have those operational definitions. So what does that mean? Are you going to only include grades? Are you only going to include achievement test scores, school ranking, graduation outcomes? You need to define what will actually qualify as an achievement outcome that will be included in your review. So here's an example from our parent training for ADHD review. And so essentially they said, our primary outcomes are going to be changes in ADHD symptoms in either the home setting or the school setting, and then any changes in general behavior. And then they say all outcomes have to be child-centered and not parent-reported. And so then that's pretty straightforward. Now, occasionally you will also see some folks restrict to outcomes that are, validated and reliable outcome measures. You certainly can do that. If you think that there are a lot of homegrown measures that are used in the field that are not really good measures of the construct that you're interested in, you can have that as part of your eligibility criteria, that you're only going to use those validated assessment instruments if it's relevant to your review topic. And then you might have some secondary outcomes, so you can see here how they've done that. Okay, so in terms of our participants, some relevant issues to consider with your eligibility criteria, obviously age or grade level if you're working with youth, risk status or disability status of the students or youth. Sorry, I'm used to working with youth, and I think that comes through in all of my examples. Thinking about demographics like gender, race and ethnicity, socioeconomic status, and then any other special or clinical populations. I think if you're working if you're interested in participant populations with disabilities, you need to have pretty clear criteria for what disability statuses you're going to include and potentially exclude. So here's an example from the same Campbell review where they define we're interested in children between the ages of 5 and 18 who do not have criteria or diagnostic problems other than ADHD, and so they've got that pretty clearly outlined here. Okay, finally, study designs. We've talked about this a little bit, but this will have implications in terms of the effect sizes that you'll be using in your meta-analysis if you're doing one. But you want to think about, again, what types of study designs are going to provide evidence that's relevant to your research question. So if you're interested in intervention effects, typically RCTs and QEDs will be relevant. We've already talked about including potentially single case subject design studies or observational designs. I also want to point out the single group pre-test, post-test designs. So this is where you've got a single group and you follow them from pre-test to post-test. You don't have a comparison group, kind of like our surveys for the workshop. Right? We're pre-testing you and we're post-testing you, but we don't have actually any comparison group. Those types of studies may be the only ones that are providing relevant research evidence, and so you certainly can include those in a systematic review and a meta-analysis. Now, you would always analyze them separately from your group design studies, but you certainly can include them. So I did a systematic review looking at the different types of treatment for adolescents with substance use disorders. And so we did kind of a standard review where we looked at what's the effect of family therapy versus cognitive behavioral therapy versus, psychoeducation versus group counseling. So that was kind of a standard group comparison. But then we did a supplementary analysis where we looked at single group studies that followed people over time, because a lot of the inpatient or residential programs, they don't have comparison groups. So those are inherently pre-experimental studies. And so what we did is a separate analysis just focusing on those single group pre-test, post-test studies to say, okay, well, for those kids who are in residential treatment, how much change do we see in their behavior? So that's certainly on the table and it's a possibility. But again, you often will analyze these different types of study designs in separate syntheses because they give you different estimates of effects. And then actually, as I was mentioning earlier, Stephen, you can often here have some quality thresholds, right? So if you say, well, I know there are a bunch of quasi-experimental studies, but they do a bad job matching and they have non-equivalence between the groups. So you can actually have some requirements in your eligibility criteria that ensures that you're really only getting those highest quality studies. Now, of course, you need to be careful with those quality thresholds because you don't want those to be subjective, but they need to be based on sort of, standard or agreed upon standards for quality. And thinking about internal validity. So attrition, baseline equivalence, those are going to be the obvious ones for group-based studies. Other things might be fidelity of implementation, assessment instrument, psychometrics, those things might come into play. Oh, and here's an example from our Campbell review. And here it looks like they only included RCTs and quasi-randomized studies, which are not quasi-experimental, but these are trials that essentially use quasi-random allocation techniques. So, for instance, randomly allocating by birth date or a record number. And then finally, you might have some other eligibility criteria that you specify. So geography is one, time. If you're only interested in recent literature, you may have, for instance, you might want to say, well, this, legislation was passed in 1985, so I'm only going to be interested in studies that are published after that. And then language is a tricky one. So most of us, unless we have multidisciplinary teams that can, that have the ability to read and understand and interpret multiple languages, you might be restricted to have, only English and Spanish language reports be eligible. And so ideally, you would always include all relevant research, regardless of the language that it's published in. But we understand at Campbell, and most reviewers, I think, understand that often that's just not possible. And so, if you say we had to restrict to English language only because of the review team capabilities, that's always understandable, and I don't think you would ever get too much criticism for that. So what you'll want to do for this next exercise is to take 5 to 10 minutes to brainstorm a research question for a systematic review topic. And you may want to use those research question templates that I provided, depending on the type of question you're interested in asking. So first, just try to structure and draft your research question. And then what I want you to do is to then start outlining some potential inclusion and exclusion criteria using those PCOS terms as appropriate. So what types of participants are you interested in? What types of interventions or comparisons, if that's applicable? the outcomes and study designs that will be relevant for this review topic. So we'll take a few minutes for you to work amongst yourselves, and then we'll come back together, and those of you who have some questions you want to, we can discuss with the group, and then get some feedback on that. And then I will be walking around the room, so just raise your hand if you need me to come over and provide any guidance. Yes? It does not have to be intervention research, so please don't feel constrained. So the I and the C may not be relevant, but I want you to really think about questions that are going to be important to you, so that may not be an intervention-focused question. Okay, so did everybody get at least a first stab at their research question? I hope so, because you will be using that in our literature searching exercises. Does anybody want to share with the group what their draft question was and get feedback? Yeah, Jay.
Let me see where I typed it out. My colleagues and I for the center or the collaborative are looking at the issue of the impact of the Medicaid expansion on working age adults with disabilities. We have a hypothesis that we're calling health insurance motivated disability enrollment, which suggests that when people have health insurance options, more health insurance options, they're less likely to apply for SSI and or SSDI. And so we're trying to figure out a way to get empirical evidence for that phenomenon.
Excellent. Any comments or reactions to that about the PICOS for this study question? So the question was, what are your study designs that you'll be including?
I assume observational and correlational stuff.
Mm-hmm. Because most of the studies would essentially, are you going to be looking at pre-expansion and then post-expansion, or post-expansion
Yes,
only?
and the Supreme Court has given us a sort of a natural experiment as well between expansion and non-expansion states.
Excellent. Okay, so you might have a combination there of studies that are doing the pre and the post versus the post with the different states.
Right.
Any other comments or reactions? And when was the expansion? What date was that for the states?
2014.
2014, okay. And so that might be a case where you would probably have some pretty clear rationale for restricting your literature search and your eligibility criteria, even if you're going to include some of those pre-states or pre-dates. You might say only go back to 2010. And then that can make the literature searching much easier to have those restrictions on the dates. But that's a pretty obvious reason why you would do that. Other questions that you want to share with the group? Because I will call on somebody if we don't have volunteers. Yes. Thanks, Lisa, from everybody in the room.
So I'd like to assess the effect of utilizing a validated risk assessment tool. Let's see, wait a second, I might have. For adults with IDD compared to an unvalidated tool. Wait, I might have messed that up. Let me start again.
Start again.
I'd like to assess the effect of utilizing a validated risk assessment tool compared to an unvalidated tool for adults with IDD living in community-based settings on fall-related incidents.
Okay, excellent.
Does that make
And
sense?
and so do you have an idea of the tools that you want to use, the validated and unvalidated, and what are those?
Well, we have one tool that we know of that's been used for this population.
Mm-hmm.
But in the community, there's a preponderance of other tools that haven't been validated for adults with IDD.
Okay.
So people use a lot of tools that might have been used with seniors, for instance, but they're not haven't been validated for this particular population, and we're trying to push the use of a validated tool. So that's the tool we'd like to test.
Great. Any feedback for Lisa? Or questions about her PCOS? Yes.
If the tools aren't validated, will there be a lot of literature? Or is it sort of more underground practice that might not be in the literature?
That's a good point.
Like it might be outside of the peer review, it might be in chat groups and hey, we use this in our
Right.
Right. And I'm not familiar with that literature, so I don't know about that tool.
I think.
Do you know what I mean? It sort of might sort of be a conundrum.
Yes.
Yes, underground practice.
Well, we have one validated tool that we know of that a state has been using for this population.
But maybe it's in the grant literature, like maybe there's Medicaid reports or program evaluations where
So it's, yes. But doesn't that, so based upon that, doesn't it drive how you develop your, inclusion criteria?
Yes, and so it's hard for me to answer this because I'm not as familiar with that literature. So, the first step, you definitely would want to do a scoping review to see what kind of literature is out there. Do you actually have literature that is comparing these two tools? Because presumably you're going to want, studies that are reporting on both. So it will depend. But I think maybe the point to consider is that when you are collecting data from these studies, something to think about is kind of feasibility and, perhaps the unvalidated tool. There's a reason it's been being used in the fields in terms of ease of implementation, and that might be something to try to collect from those studies that are included.
Okay.
Any other comments or reactions? Okay, I need a third volunteer. Yes, Stephen.
Give it a shot. So our group is looking at adults with autism spectrum disorder and state vocational rehabilitation. So the question that I put was, does additional knowledge of training on ASD for state vocational rehabilitation staff increase employment outcomes for clients who have been diagnosed?
Okay, and so what are the types of study designs you're thinking would be eligible for that?
So I think that would be as broad as possible because that's a fairly specific research question. So single group, pre-test, post-test, RCTs, quasi-experimental, pretty much everything.
Okay, so that's good, but just be aware that by taking that broad approach and including those multiple types of designs, you will have to search broader, which is fine. And then for any meta-analysis that you do, we'll talk about tomorrow, you will be doing those separately for the different types of designs. So the group comparison designs, the single case designs, and the observational designs. And that's perfectly fine. It's perfectly justifiable. But it's a larger project, hence the broader scope. I know I was talking to Jasmine about that in the back. And it's fine for you to take these broader approaches, and sometimes folks will answer or ask two related questions and have essentially two parallel reviews going on the same topic. And so she was interested in essentially a correlational review as well as an intervention effect review. And so I gave her an example of a Campbell team who essentially what they were interested in was the effects of gang interventions, so interventions to reduce gang affiliation and gang membership in lower and middle income countries. And so what they ended up doing was one review on what are the effects of these interventions, but then they did a second parallel review looking at what are the correlates of gang membership. So essentially two different review questions, two different topics, but on the same general topic. And so that certainly you can do that, and if you do the search at the same time, that can be efficient. There we go. So any other questions about this exercise or reactions or thoughts? before we move on to literature searching? Yes.
I was just debating whether to comment or not, because I'm obviously in this very obscure area of systematic review, which is assessment tools. And so as I sort of went through the list, there was a lot of none, I don't know, right? So there's no intervention, there's no comparison group. I'm not sure it really matters about the study design. So...
Well, but I think you just need to be flexible in terms of that. So why don't you tell us what your question is, and we can try to be flexible in making it fit in. I mean, it not necessarily will fit into all of those, but we can think about similar constructs that will be relevant to an assessment review.
So my question is, what is the content validity of assessments of neurobehavioral function in patients with severe traumatic brain injury?
Okay. And so really, let's start with your outcome. That's the first thing I heard, which is content validity, right? That is your outcome. And so how will you operationally define content validity?
So there are a couple of international standards for thinking about neurobehavioral function called the Aspen criteria and a couple others. So I think those would at least guide what would be considered the domains of the...
Okay, and so a measure then, can it just be content valid or not, or are there variations, or is this a continuous measure of content validity?
I think it's going to be to what extent does an assessment cover all those domains or just one of them?
Okay.
Or two of them, or, subset of them.
So we've defined your outcome, so read your research question again.
What is the content validity of assessments of neurobehavioral function in patients with severe traumatic brain injury?
Okay, so we've got patients with severe and traumatic brain injury, that's your population, and so you might have some criteria about what actually, qualifies a participant to fall in that category. And then really I would say kind of the intervention here that we're thinking about are the assessment tools. And so for you, that might mean, are you going to look at just a specific group of assessment tools? You have a predefined list? Are you going to be looking at any assessment tool?
Really anything. We want to look in the literature and see what have people used. Are they using biomarkers? Are they using observation? What kind of tools are they using?
Okay, and so that's
using brain scans.
Right. And so that's kind of your intervention, and but you're taking a broader review scope here where you're going to include any type of intervention that is looking at this outcome with this population.
Okay.
So I think all of those fit except for the C.
Okay.
Right?
Yep. Okay.
You've talked about how it can be legitimate to restrict reviews to studies in certain languages, or perhaps we're interested only in a domestic population. Can you give examples where it was pretty legitimate and didn't affect the rigor of her review by including only fairly recent studies? Because that would be another way to cut down on the scope of the work.
So I think it varies. I think if you're talking about interventions or programs or policies that are recent, I think Jay's example was a good one where it's fine for you to restrict to recent studies because it makes sense. We don't want to be comparing, pre to post from 1980 to 2015. So I think when there are policies or practices or legislation that's been enacted, I think those are probably the most obvious cases where restricting your publication date is justifiable. But if you have a strong substantive reason to believe that your population or your participant has, if the population that you're working with has changed, or if the types of services that might be provided in an intervention have changed, then that might be another justification. And I don't have a good example of that I think, so in my field, for instance, we often, when we're focusing on adolescent substance abuse treatment, we often will restrict, from the 1990s on, just because prior to the 1990s, nobody was researching adolescents with addiction problems. Everybody was focused on adults. And so you might think about kind of those historical shifts in terms of research interest, that if you know there's going to be a low yield in the 80s or the 70s, that's also a legitimate reason. So I think if you know it's going to be a low yield, or you have a substantive reason that policies have changed, your populations have changed, maybe the demographics of the people you're working with, or how those interventions are actually implemented, if those have changed, you might have good reason to restrict. So sometimes education reviews might be restricted, because if we think about sort of common practice or business as usual in educational settings, that varies a lot from 1970 to 2015. And if all of your comparison conditions are business as usual in schools, there's some bananas in your fruit salad. So I don't know if that's a good example. Does anybody in the room have another example for why you might restrict to more recent studies? Because it really does assist you in the literature search, and it makes the results more manageable if you can reduce that. Yes?
Well, like for my example, I think the Aspen criteria only existed, I don't remember off the top of my head what year, but so you wouldn't expect tools before that to necessarily be relevant to the question.
Yeah. So that's an example of kind of using a specific date for some passage of some legislation or a policy or a recommendation. Other questions before we move on to literature searching?